Hi, today I want to talk about lumbar canal stenosis. It's a common problem that I see that patients come to see me with, often because they've had a scan somewhere and that's come up on the report, or the signs and symptoms that they have are in keeping with it, and a physiotherapist I work with or osteopath or chiropractor has sent them to me. Patients with this tend to complain of pain in the lower back that radiates down one or both legs. It usually comes on or is made worse by walking, and patients tend to find that their walking distance gets shorter and shorter until they get to the point where, even if they're just standing for a few minutes, they can feel pain in the back going down both legs. Sometimes you can get numbness down the back of the legs, and as it gets quite bad, you can even become unsteady on your feet, particularly if you notice when you're looking up to take something out of a cupboard, change a light bulb, hang up washing. Any kind of action that involves looking up can sometimes cause unsteadiness. It tends to be patients who are in their 50s or 60s and above, but occasionally you can see it in younger patients, and it's due to wear and tear in the spine. It's a lot easier to explain this with an MRI scan, and that's usually the investigation of choice. So here is a typical MRI scan of someone with lumbar canal stenosis. The image we see here on the left is called a sagittal view, and this is a slice right down the middle of the body. So this is the back, the patient's back, and this is the patient's front. So all this unit here is the lower back, the lower lumbar spine. It's made up of a stack of bones here called vertebrae. Each block of bone has an arch of bone attached to the back. And when you stack these up, you form the central spinal canal, which is a type of tunnel that runs down the middle of the spine. And in that tunnel, that contains the spinal cord, this grey structure here. And then that finishes here. And then below, we have all the nerves that are hanging down. You can probably notice or appreciate in this patient, this channel, this white tunnel, suddenly gets very tight here and then widens up again. The name stenosis, or the word stenosis, is a Greek word that means narrowing, and that's exactly what this is. If we look at this picture here, this is a view of slices across the waist. So classically we have, this is the front here, the back, the right and the left, and this is the skin of the patient's back. This here is the lumbar spinal canal, which is this bit here. I'm just showing you a normal level. That's the vertebral body at the front. This is the arch of bone at the back. And that's what things should look like, a nice big white canal. It looks white, and these dots are the nerves. As we start making our way down to the narrow segment, you can see that space now completely shuts off. And that's been caused by a combination of an overgrowth of these joints called facet joints due to wear and tear, thickening of this black stuff here, which is the ligament at the back, which is this bit here. And in this patient, partly sometimes you can see it due to one bone slipping forward ever so slightly over the other, and that's called a spondylolisthesis. So how do we treat this? Well, if the symptoms haven't been around for that long, then I try and avoid anything invasive in the beginning. I recently wrote a blog about IDD therapy, which is something that some of the osteopaths and physiotherapy partners I have offer, where you are strapped to one of these traction tables, and it can accurately place the center of traction around the segment of the spine that's narrowed. And after a few sessions, it can help just create a little bit of space around the nerves. That's something relatively safe and worth considering. So if physiotherapy and these conservative measures have failed, in my opinion, I don't think injections work very well in this scenario. You've got a very tight space that you're trying to inject fluid into, and it doesn't so epidural injections, in my opinion, are a complete waste of time. So then the next thing to think about is a form of surgery or minimally invasive surgery to the spine. So if we take this picture here, this is the skin of the back, the right and the left, that's the back of the spine, this is the front. Through a very small incision, we can come in and with a direct view under the microscope, make a little opening in the back of the spine and just start to undercut all this thickened ligament and overgrown bone to just widen up this space and create room around the nerves. A lot of patients have often been online and have read about the risks of spinal surgery, such as paralysis, incontinence, and things like that. These risks are extremely rare, especially through minimally invasive approaches. Even so, as I said, I work with a team of osteopaths, physiotherapists, and chiropractors at the Spine MDT, and together we try and find the least invasive solution for you that can give you the longest lasting result. I hope you find the video helpful. If you want to learn more about our packages of care or our one-stop spine clinic with the scan included, please click on the link below or call us or email us. We'll be very happy to help you. Thank you.